The main theme of the 38th Annual BC Care Providers Association Conference was Sustainability through Innovation. This year's opening session featured a panel discussion on the subject of innovation in the continuing care sector and was highlighted by keynote speaker and former Premier of Prince Edward Island, Robert Giz. Giz has been involved in the sector in the past and is excited about where it can be taken in the future.
Well, I have a passion for this. This is something that I think could be one of the most critical public policy issues that we face as a nation over the next 30 years. We know that the challenges that exist today with an aging population, with the costs associated with that. Today we have a seniors population that is dominant within our healthcare system needs, and we need to adapt as a nation.
Giz understands the many issues the continuing care sector faces, but he is also confident that these issues can and will be addressed by the provincial and federal governments in years to come.
That this is a serious issue, but there is a lot of hope, and that there is a lot of innovations out there, but we just need people to work together. And until we get our 13 jurisdictions, 10 provinces, 3 territories, and our federal government all at the table together. Every major national program that's ever existed in our country has had the federal government at the table. And this is a major public policy issue, and I hope that in the next federal election that this will be an issue that will come to the forefront.
The highlight of the former Premier's continuing care resume is co-founding the first Healthcare Innovation Working Group, which assembled key decision makers, including premiers and provincial and territorial ministers of health, with the goal of being able to better address needs and challenges in the healthcare system.
You know, for too long we've been functioning in Canada with 13 distinctive healthcare systems, all running different silos, where, yes, there's been some minor collaboration, but it's moved very slowly. So back in 2012, when Brad Wall and I first became the co-leads of the Healthcare Innovation Working Group, it was really an opportunity for premiers to drive the agenda. It allowed things to move much faster. We looked for areas where we could collaborate together to deliver best practices across the country.
Giz believes that conferences like these are an effective way of sparking discussions that ultimately initiate change.
You know, it was a great opportunity for a discussion on the importance of an aging population within our country, but also looking for innovations to help make sure that as we do age as a population, we're able to provide the services that our seniors are going to need, and that's really what it's about.
For the BC Care Providers Association, I'm Jesse Adamson.